Welcome back, everyone. You know, before the break, we shared some solutions to relieving back pain without medications. And one of those tips that you see on your screen is exercise. Of course, aside from quitting to smoke and maybe doing some yoga. But joining us once again to demonstrate 5 exercises that can relieve your aches and pains is Pedro Romero. He's a physical therapist at the Adventist Health Spine and Pain Center in Hanford. And before we start with our exercises, Pedro, where exactly are you located? And where can people get hold of you?
Oh, we're in Hanford. Our information should come up at some point.
Yes, it has.
Yeah, we're in Hanford, the Spine and Pain Center, and we're there to help as many people as we can with back pain.
Obviously, this is a big problem, a very common problem among many people. So, what are some of the exercises that we can do at home to maybe try and treat some of these problems?
So I'm going to show you basic ones. Disclaimer is it is better to be on a firm surface, but if you can't get on the ground, then for sure in bed, doing them in bed.
Oh, really?
So
as soon as you get up. See, I was supposed to wear my yoga pants and help you out here, Pedro,
that's all right.
But I'm just going to watch and learn.
A lot of people will say, well, I have back pain, I can't exercise.
Yeah.
So I like to start out with a very basic one, which is for back pain, we want to improve our core strength. So what we are doing is we're laying down, and it's kind of a primer exercise. It's just basically contracting your abdomen muscles.
Like breathing
or your
in and
core
out?
muscles. So what you're doing is you're tightening them up, not holding your breath, just kind of tightening everything up. So, and you want to do that a few times kind of as a primer exercise, okay? From there, I like to have people progress it a little bit more. And so we'll start incorporating some movement into it. So we engage our core muscles and we lift one leg up, bring it back down, lift another leg up and bring it back down. So, and there are varying degrees of progression. These are obviously for people who are in more pain or have been experiencing chronic pain and are afraid of movement.
Oh, so, because that doesn't seem too difficult.
Right. So for someone like maybe who's not dealing with pain, like me and you, we would progress it a little bit more. And I'm going to show you slightly more advanced exercises here in a little bit, okay?
Got it, got it.
So I need the
strap. Okay.
And for this one, we're doing a stretch, a hamstring stretch, which we know that if our hamstrings are tight, then it can contribute to back pain. So I have a nice dandy strap. At home, you can use a belt, you can use a rope, but you want to bring your leg and you want to hold it for a few seconds.
But you're pulling in, you're not just... you're making and feeling the stretch.
Yes, exactly. So you're feeling the stretch to the back of your leg. Usually 15 to 45 seconds is a typical stretch, and you want to go gentle. You don't want to just pull on it. You want to go gentle. Okay? So yeah. Now,
that's a good one.
If your back hurts, if you noticed I kept this leg bent, that's because it helps to relieve some of the pressure on the back. Some people don't feel comfortable with it, and you would obviously switch and go to the other side and do both sides. Okay? All right. Now, for those of us that are a little bit more advanced, I like to use the ball because anytime we're sitting on this one, our core is engaged. So we are... just the mere fact of sitting on the ball, already our muscles have to work to keep us from falling off of it, okay? So I like to start out with a basic one where you are here, you're using your hands to support yourself, and you are engaging your core muscles while lifting one leg up and lifting the other leg up. And if you try this, it's a lot harder than it seems to
let me
not
try,
fall
because
off
I can
the
try
ball.
that one. But, so because it looks very easy. It really does. And I'll tell everybody the truth.
All right. So
I
what you
hold
want
on
to
to
do?
the ball?
Yes, with your hands. And then you engage your core muscles. And then you try to lift one leg up. And
I can see. I can feel my core tightening up.
Good. And then you lift the other one up and back down. So you don't have to hold it very long because it does become more challenging the longer you hold it. But it's something simple that you can do. And if you have one of these at home, then you can do these.
You know why it's hard for me, right? Because I'm not wearing gym shoes and yoga pants. Otherwise, it'd be a breeze. It'd be super easy.
Right.
537-0325 is a number to call. Lots of great tips and exercises, and I'm sure that you can help people alleviate their pain with simple exercises like this, right, Pedro?
Absolutely, yes.
Yeah. These were great.
The most important thing is getting people moving again, which, you know, sometimes we have pain, we don't want to move, but getting moving again is extremely important.
So walking, is running really bad for you?
Not really bad if you don't have back pain, but maybe you have back pain, you want to do activities that are less stress on your back, like swimming or cycling, which are less impact on your lower back.
Okay, lots of great tips. Yeah. Thank you so much, Pedro, and you can find them at Adventist Health. The address is right there on your screen, 470 North Greenfield Avenue, Suite 303 there in Hanford, or you can also give them a call. That number has been flashing on your screen as well. Lots of great information, ahspinecenter.com. Thanks again.
Thank you.